So she's about 70. No,
Yes,
46.
sir.
So she'll be 80.
Oh, now I need to go out there.
See, I'm telling you.
You tempted me.
It's a plenty.
Well, this is real shit. All this. I know you're gonna have that the other two, so that's.
We want to do something, but I don't know that it'll be as
That's why I want to hear about all the 70-year marriages.
Because it is from.
I took my honeymoon
Yeah.
for all my years.
That'll have a big dinner.
I know, right?
Yeah.
Oh, still, I mean, well, I don't know about mine is big. No, this is Ryan, he's an intern with us.
Oh, okay.
Yeah, yeah.
I have to be at home.
Well, but he's supposed to be all up in Karen's business if we don't watch out, so. How's it going? I just kept coming last week, we had an all-day staff meeting.
There's somebody that's walking outside. No problem. We got food out here, the drinks in the back of the fridge. We can pick out a chair.
I mean, those are some good pictures of y'all that they got.
Oh, good podcast.
Yeah, I didn't listen, but not yet, but I did see the pictures. On Facebook. I'm excited too, and I just hope, I got some resources in there when this person's stuff dries up.
She said. Yeah.
Hospital? If I'm willing to.
You tempted me. Your fault. Yeah, right.
Gotta have somebody who holds it together.
Oh.
Exactly. So I'm proud of her. If you don't.
Yeah. I mean, just like that last thing she gave that, one of those opioid settlements, just like 0.5 events this past month or something like that. And I was like, that's more events than he did in a whole year in 2022.
I know, right? We gave up.
That's awesome.
Yeah.
Well, I'll have to check in with him because that's how I was super special. Because he worked it, but I wonder someone to be like,
Keith B. Reynolds. So Keith, I can.
yeah, no, he calls.
My first name.
Pretty good.
Ferrari. And then I have to eat before I go.
Y'all feel free to take your time. I think we'll get started about 6:20. Just give y'all some time to network and catch up. Let anybody else scroll in. That's gonna go. Thank y'all for coming.
Marie, what's up? Hey, something like that. Yeah, were you in the area or just felt moved by the spirit?
I'm sorry.
One in Tarboro, one in Pant.
Public school forum for Carolina.
Sounds great. Sounds like good work. North Carolina, what it's on the directive too, is that coalition or?
They're not really like really hard that the school meeting, they're not really about the it is like the year full time they're doing it. Just some we
Part of the agenda, the meeting, wow, that's the day. Not one I tried to facilitate.
Right.
No, I've never been to the mall either. I wait for the people. No, I haven't seen it. But it starts last week. This is Omari.
Nice to meet you.
Omari is the program officer for our region in for the figure of chair, which you will definitely heard about.
Definitely, and I think maybe almost every meeting that we've had so far, but
Hopefully makes sense.
No, yeah, that's
With school meeting.
yeah, I just graduated from UNC 3 weeks ago or so now, and I'm taking a break. I'm not going directly to a like master's for everything, so. We got splitting sometimes. I'm splitting right now. Pick County and then Chow County. Let us know.
It's like
Get out. Yeah, right now, it's River, 12 on First Street.
Okay, sounds good.
And we can start.
Okay, good. Hello, how are you?
You said earlier.
I didn't know your name. With here.
Yeah. You don't know people see our voice. Yeah, we did that.
Yes, C-A-R-E, capital.
Yeah,
That's
like,
for political
it's
It's L-A-L-A.
Utilize that, like, yes, and we utilize it.
Dot, UNC, health, dot, UNC, dot, sorry. Thank you.
Say firsthand, I
Thanks,
appreciate it.
Melanie.
Hey, how are you?
I know, how are you?
I mean, there's some, you know,
How are you? This is Lydia. This is nice.
Yeah, this is early.
We, I'm, yeah, we're ready to do a billboard.
That's what she has said. She's like, well, maybe like organization.
Interaction.
Yeah. So I think that's we may be calling you.
Better. So she just finished that. Yeah, just finished that.
Okay.
I learned a lot about what they don't do.
Yeah. Okay. Well, good. Doesn't get anything perfect. Yeah.
Yes. For sure, and I know that I've seen.
It'll work. And so tomorrow, Tia and Nick will meet with Rebecca. We're in Davis Green, and she's from Florida.
Areas right now.
And so we're going to talk about some of the, how we
Doing well. How about you?
I don't know what this is supposed to be today, is to hear about
Yeah. Very common. So my guess is that's roughly where
and they're not afraid to say they're paying for anybody.
Child first.
And I can't, I talked to Jeff over at our, you know, you just can't do the work without them. So the money can get somebody also.
Yeah, she was there for a time. Now, I guess the child.
I know. The worst part is very
enjoys it, feels quite hot.
But she doesn't go to go back, because she's been out for 20 years. She doesn't really do that.
Yeah, as you should.
Stay on it so long.
Yeah.
But she's
I'm
lost
just
a lot
now,
of
right?
stuff.
Talking about stuff.
Stuff is just not good. So,
Yeah, I'll keep my, like, how.
yeah. And a lot of her classes, and she runs a lot. I'm even trying to get, she's gonna go to school support training. And I'm trying to get her to learn how to do, draw blood. I think that works about it. Yeah, and she, we have money, so that she can get into the department. Right, was training at AHEC for, substance use disorder. She, yeah, she was there. And everybody gets right there. And the girl who was but that's it. She was at the time. She just, and I was talking about this. So that is, but anyway, she was a long competition.
I've been doing good.
She would say, no, my daughter's so much. Constant, I don't care. Thanks. So, she's got a lot of fun. I get it and whatever, and I don't mind. She has really great outreach. That is her skill. She is. People approach her, just to have conversations. So I will see.
My schedule didn't take a bit. Take my cat to.
I wasn't worried enough when I got off at 11. I got off my thing at 12. So I'm trying to stand up and be off for hours. And doctor walked in. I don't think it's
Yesterday actually was, we met with, some people from Edgecombe, EMS. Also kind of with.
Clean up around the house. Because I'm kind of worried about
For you, mostly just.
I was having this, like, interesting around she's not healthy, young.
So what is that, I guess, look like? What is your?
They don't care about oh, that's who you know as Cowboy. That's my granddad.
And so then when I got told this, so I had to look about and I told her she my background in finance.
Was he short?
Somebody comes in and is an administrator for the grant. And his body
I guess, knowing what, like, I guess, we could.
He works part-time out at Lamb Fields. He works at the North side.
And then she added another 180 to the addition. She's willing to work with me. Inclusion on that, but.
I should like get grassroots stuff.
I was gonna upload my videos up to YouTube, but I tested.
All right.
I think that'd be good. Oh, that's okay. Oh, that's all right, that's all right. Hi, how are you, honey? You got your boxes, right? Good, good, good. You're welcome, you're welcome.
I need some more damn knocking.
Okay, all right, I'll get you some.
Thank y'all for coming tonight. We'll go ahead and get this thing kicked off. Appreciate everybody's time and hope you get a lot out of it tonight. We're a small but mighty crowd here in Rocky Mount, but it's always good to be out here. This is the first time we've done this in Rocky Mount, so I'm really excited about the event. We've got a lot to share today about some of the good things that have happened in the past couple of years and really over the last fiscal year. And then we'll kind of talk a little bit about some of the challenges that we faced as well. The cool part is that I know about everybody in the room, which is really neat. I don't see any pitchforks and torches, so that's good. So yeah, just very thankful that you guys came out tonight, and we'll get started here. So the reason that we are here in Rocky Mount today is every year, if we spend opioid settlement dollars in the county, we have to host an annual public forum. And last year, I don't know if y'all went to the one in Tarboro, and it was pretty well attended, but that was the only one that we did. And we're so spread out in Edgecombe County, we felt like it was the right thing to do to show some love to Rocky Mount. We'll be traveling to Pine Tops next week, and then we'll be back home in Tarboro the following week after that. It'll be basically the same presentation each time. The food's probably going to be a little bit better here than it will be in Pine Tops and Tarboro, but we're going to hopefully have some refreshments at those as well. So if you know somebody's interested in coming, they couldn't come tonight, we've got some basically some information about the next two sessions as well. So basically what we'll do today, we'll talk a little bit about what the funding is, what it can do, what it can't do, and then we'll show you guys how we have elected to spend the funds, and then we'll kind of jump into some of the strategies that we've basically, new things that we've done this year. But before I get too far into the weeds, I did want to say that my name is Dalton. I'm from the government. I'm here to help, all that good stuff. But I manage the opioid settlement for Edgecombe County. But I started out on the street as a paramedic. So the opioid crisis has always kind of been near and dear to my heart. I've kind of seen it from the street level. And then, just the right things happened, and I kind of fell into control. We've got a number of people here from Edgecombe County in the back, on Chad, and then we've got the partner Trent up here in the front as well. So glad to have you with us today. So the opioid settlement funds. The opioid settlement's been around for 25 years. In the late 90s, it's kind of the start with OxyContin. After we learned that was highly addictive, we had a lot of things happen. The drugs began to change, and then a lot of people, unfortunately, started to pass away. So today, we are dealing with a huge crisis on our hands that oftentimes flies underneath the radar. One of the big statistics that pops out to me is that more people die of drug overdoses than they die of motor vehicle collisions and gun violence put together. That is a big problem. And a lot of times that goes kind of under the radar. Nobody wants to pull the Band-Aid back on that. But we're here to talk a little bit about that tonight. So, there was a lot of money that got pulled out of some litigation with some of the pharmaceutical distributors like Cardinal and McKesson and some of those companies. There was different waves of the settlement. Initially, Edgecombe was getting like 4.5 million, and then it was, with wave 2 and some of the other ones, we're getting right at $5 million. And that's the total settlement altogether. That money, it started coming in 2022. We're in 25 now, which is hard to believe, and it goes until 2038, I believe. I think it's 18 years, somewhere in there. It's 18-year settlement. And in order to spend that money, each county basically has to decide. And that's decided in Edgecombe County by the county commissioners. So anything we felt like was a good idea, we had to write it up, get it approved by the county commissioners, and then it kind of rolls down the pipe from there. So you have to have buy-in from all different types of things, nonprofits, working with county government, working with all of the other stakeholders in the area. So like I said, Edgecombe County got $5 million. Edgecombe County's been hit pretty hard by the opioid crisis, and we continue to see the numbers go up. In 2023, we actually saw some of the overdose trends go down in many of the big cities and areas like that. But there's always people left out of that. And Edgecombe County, I feel like, was one of those places. So kind of what you see on the left-hand side of the screen, I know it's really hard to see from the back, but that's our death rate. So our death rate right now in 2024, the data is a little bit behind because we look at the Office of Medical Examiner to get that data. And the projection for 2024 is 86 out of 100,000 people. Keep in mind, Edgecombe County, we only have about 50,000 of our population, but that represents 42 different people. That's a lot of folks, right? If a school bus crashed, that kind of, puts things into perspective, for me, numbers-wise. And we're one of the highest ones, that's projected for 2024. We're number 2 right here, and then number 1 is right there. But as you can see, there's a lot of the rural areas that are in those, those hot looking colors. So we're being kind of left behind. This is a link to the Core NC dashboard. If anybody's familiar with that, that is the search engine that kind of lets you figure out what the local progress of everything has been with the opioid settlement. It shows you who's spending money, who is not, what the plans are of that money pot. And then it kind of you can pull up some statistics about like the opioid crisis and things like that. But that's the URL to that website there. So the settlement is broken down into a few different parts. You've probably heard of Exhibit A and Exhibit B. Exhibit A is essentially just a list of 12 strategies that you can pick from post-overdose response teams to Narcan distribution and pretty generic type of strategies that can be quickly authorized. And then that spending can take place. And that can be like a county program, or it could be like a subrecipient, like a nonprofit, or, like a clinic, or anybody like that who's doing that type of work. There's a little bit of a process to open up the door for Exhibit B, which is where we're headed. Exhibit B is a little bit more intricate. I think the document has like 32 pages of different things that you can do within that. So that's where we're headed. It takes us a little bit longer to do that just because of manpower and some of those requirements for that processing. But we are headed there because most of the prevention strategies that you can fund come out of option B. And that's where kind of we need to shift going forward. These are the option A strategies here. The ones that are a little bit darker in white are the ones that we're currently doing. So we're doing 6 of those, right? So collaborative strategic planning, which is what we were able to secure the venue with and to do our meetings and, facilitate all of that. An evidence-based addiction treatment, that is a new one for this fiscal year. We recognized as we were doing the post-overdose response that one of the issues that we had is that we couldn't get people into treatment quick enough. We would refer them to treatment, and it would be a week starting out, which was great, but now it's, 2 weeks or 2.5 weeks, and that kind of hinders our ability to search out for more patients in the meantime. So we knew that we had to fund that, and I'll talk a little bit about who was awarded for those.
The third one is recovery support services. Starting out, that was the community paramedic program. We have now transitioned to the post-overdose response team, which is number 8 there on the right-hand side of the screen. Naloxone distribution, we've been doing this pretty much since the start, and then the syringe services program as well. Hopefully in the future, we'll have all 12 authorized strategies, because as you can see, they kind of, nail certain social determinants of health, or they nail certain parts of the continuum of care where a person with opioid use disorder could be, specifically incarcerated people, reentry projects, early intervention, things like that. So we're looking to kind of push more into those strategies, definitely over the next fiscal year. So the 4 probably most active strategies that we've done in Edgecombe County so far. Number 1 is the post-overdose response team. That's how I got my start. I come off the road as a paramedic. We started planning the post-overdose response team. We have two people that ride on that today, me and Trent. And our job is to do follow-ups with patients after they've overdosed, or, any type of referral that we may get. As the overdose events are decreasing, our touch points could potentially decrease, and we don't want that to happen. So we're always looking for different ways to meet people where they are before that overdose even happens. So I don't really like the name post-overdose response team. We want to be pre-overdose response team or intra-overdose response team, because oftentimes we go to the scene and we're with them in that moment. Number 2, the Edgecombe Safe Syringe Initiative. This is not something new to the county. They've been doing this since 2019, but we rebranded that in 2023, added some things, made it a little bit more accessible. And right now we're doing it through both locations in the health department. We also do it at Freedom Hill Community Health Center for their patients. And then also we do a mobile extension side of that via the post-overdose response team. So we have multiple different ways that you can get supplies to the patients that need them. Whether it be mobile, being delivered out to the rural areas in Whitakers, or somebody just wants to stop by Rocky Mountain, they can do that too. Number 3, naloxone distribution. That was something that was happening in the health department as well, kind of tagged along with the ESSI, or the Safe Syringe Initiative. We rebranded that as well. We have naloxone that we can give out at community events, things of that nature. We have 24/7 naloxone distribution aboard all of the EMS vehicles in the county. So if they go to an overdose and me and Trent can't go to that patient is still left with naloxone. And oftentimes they're left with the breathing device that they used at the scene as well. So that's really, really awesome. The health department is doing that as well, Freedom Hill. And then one of the things, unfortunate things that we had happen in 2023 was that we had a 32-year-old that was living not too far from this location today. He was discharged. He was left out of jail late September of 2023. He overdosed with his twin brother October the 1st. And then EMS went, they gave him Narcan, he went to a local hospital, was discharged. A week later, he overdosed, and unfortunately, he died. But one of the reasons for that is that his tolerance was decreased during his stay in the jail, because they did not start MAT at the jail at the time. So when he got out, he kind of went back to the same things, and he had 2 overdoses within that time frame. So one of the things that we did last year was we launched the Narcan vending machine in the detention center. And the idea behind that is to at least give them a box of Narcan with contact information for resources when they do get out of jail. They can call us or call whomever and get plugged in. And hopefully nobody passes away just because of a tolerance issue. We don't want that to happen. And then last but not least, evidence-based addiction treatment. The 2 awardees, we had an RFP process this year. We were really looking for people that did medication-based treatment. And we only had one that was within the county get awarded, and that was Freedom Hill Community Health Center in Tarboro. They do office-based opioid treatment. And we are really the closest methadone facility to Edgecombe County, Rocky Mountain Treatment Center, just across the tracks in Nash. They were the other awardee. A lot of times we try to push people towards Suboxone doing the post-overdose team, just because of its convenience and things like that. But sometimes they need methadone, and Rocky Mount Treatment Center was the place that they could go. But when they would go there, sometimes there was a barrier with having to go multiple times a day, or multiple times a week, or they couldn't afford the services. So Freedom Hills RFP opened up 14 more appointments each week, so that kind of helped take the burden off of us. And then Rocky Mountain Treatments RFP, they're subsidizing treatment for Edgecombe County residents there. So it's Edgecombe County money. It may be at a Nash County clinic, but it's still Edgecombe County people that it's servicing. So we wanted to make sure that that was clear tonight. This is a couple of pictures of some of the presentations that we've done. We've been very busy across the state. We're doing some really, really awesome things with the 14. We have a training coming up for anybody who's interested in coming. It'll be at the Fountain Park area at the Edgecombe Works building. We'll have a QR code come up in a minute about that training. But we start people on Suboxone in the field, either during an overdose or after an overdose, or if they just have opioid withdrawal. We did one today, matter of fact, and it went really, really well. We can provide overdose follow-ups, recovery support, and just try to help that person navigate the resources that are out there. Although we don't have a million of them, there are some people doing some excellent work in our community, and we want to point them in the right direction. We are doing community education events. We go to Coastal Plain Hospital about every week to do groups with the people there. Coastal Plain is an inpatient psych and substance use facility over at the campus at Nash General. And we go in there and we have a good time. And we go to as many community events as we can. And we've also done some programming at the Edgecombe County Detention Center about some of the street drug trends that we've seen lately. We've been on the news a few times about some of the drugs and the changes. We go and hang out with the CARE Coalition, and we have great information sharing time with them also. Just this year, we've trained almost 450 people on how to give Narcan, so that's a lot. Edgecombe County Safe Syringe Initiative, I mentioned a little bit about how you can access that. If someone's interested in the mobile syringe exchange, they just contact us basically. And each location can check for Hep C, syphilis, and HIV at the same time for free. No questions asked. So that's a really, really awesome tool for us. Edgecombe County has one of the highest Hep C, HIV transmission rates and diagnosis rates in the state. And that's one thing we're working very hard to try to correct. So if we can diagnose the HIV and the Hep C from just the needle exchange and get them into treatment, that has the potential to save a lot of secondary infections as well. Right now, we have 28 different people in just the mobile extension site, just the post-overdose team's syringe program. We've been doing it a little over 2 years now, and 4 of those participants are no longer using drugs. So that's pretty awesome. We had one get out of the hospital last week. He'd been in the ICU at Greenville for an IV site infection for 4 months. He got out of the hospital. He lost everything. His hotel room, his girlfriend, all that good stuff. And he called us, and we were able to plug him into treatment, give him some food that day. And he has been to the appointments. And I tell you, sometimes it feels like you do more work than some of the patients that are not motivated. But to the ones that are motivated, you just can't hold them back. And that has been the case for this individual. And it's been really, really awesome to see that happen. This was some guy that I never would have thought he would have stopped using. But that was a big deal. Naloxone, some other things for that. We have a lot of 1 boxes in the community. All the schools, Northeast Carolina Prep, the Edgecombe County Public School Systems, they have received training on naloxone, and most of them have the 1 box, which is that device that looks like an AED that kind of walks you through the steps of giving someone naloxone, even if you've never given it before. We have a Narcan vending machine that I mentioned earlier. We're doing distribution through emergency services. And then we also have some community partners as well. So a couple of those is Miss Berta Boyd. She's out in the community and she does a lot of things with some of the youth. Mr. Kendrick Pittman as well. He's doing some good work. And then this young lady, has opened up her home for like donations and things like that on the front porch, and we put some Narcan down there also. And it was like the next week that we started doing that, there was a person that lived behind her that got reversed from one of those Narcans that was on her front porch. So that was really, really cool. And she's just doing it out of the kindness of her own heart. So what a cool partnership that was. And then last but not least, we wanted to include our friends from Freedom Hill and Rocky Mount Treatment up here. Just some numbers for you all. This year we have done 34 different referrals to care. So that means that we've seen someone in addiction and successfully referred them to services. We have seen, our caseload usually stays around 20 people a month, somewhere in there. Sometimes it fluctuates. Some people we see multiple times a week. Some of them are, once every so often. So a caseload is usually around 20. The kit on the left-hand side of the screen is what you would get if you overdosed in the field and you didn't go to the hospital. That's the kit that EMS leaves you. There's a couple of brochures, some drug testing strips, some never use alone flyers, some naloxone, two doses of that, and then also the oxygen cans. We started giving those out as well because we saw some of the changes with the drug supply, and we knew that sometimes these patients wouldn't respond as quickly to naloxone, so we had to add something else in there, and that was in the form of those oxygen cans. So that's been added a couple of months ago. Just this fiscal year, we've collected almost 2,500 syringes. Doing our best to protect the public, making sure those are disposed of, making sure bloodborne pathogens are not being spread around. So that was a really cool statistic. This has exploded this year. Last year we did not get as much engagement with that, but people are starting to find out about it. It's not as weird to them that a paramedic is helping them with their harm reduction supplies anymore. So we changed the game for that. And then we've given out a lot of naloxone. Those are old figures on the top. I think we're somewhere in the neighborhood of 470 boxes in the community this year. And we started catching the data on some of the reversals that we're aware of. And that's very difficult data to collect, but I think we've got like somewhere around 15 or 20 or somewhere in there of the ones that we've confirmed. This is the link to the port training. So it'd be beneficial to anybody who's interested in doing like post-overdose response team type of work. We've got a lot of other counties sending EMS folks to that training, but we were one of the sites that the state picked to do that. But really the most exciting event that's coming up is the Photo Voice exhibit. Is anybody familiar with Photo Voice at all? Awesome. So basically Photo Voice utilizes pictures and adds captions to them to affect some type of change. So we've been a program for almost 2 years, over 2 years now, and we wanted to do a qualitative review of our services to make sure that we're meeting the needs of the people that we encounter. So what we did is we worked with the Duke School of Nursing, and we got this Photo Voice project IRB approved, which if anybody's done clinical research, you know how pain in the butt those trainings can be. But nonetheless, we did a series of 6 different sessions with 7 different participants that have come through our program that are in recovery now. And this is their reflection on their recovery. This is the challenges they faced. These are the things that they've noticed along the way. These were the people that were in their corner, right? And this exhibit will be basically all of the pictures and their captions from those group sessions displayed for the public to see. We're hopeful that the governor's, somebody from the governor's office will come. We don't know if it'll be the first lady or the governor himself, but it'll be a great event. It'll be held in the Mobley Atrium of the Edgecombe Community College campus in Tarboro. That'll be from, we'll say 5 to 7 that day, probably. We hope to have some food at that one as well, but that'll be a really, really great event. This is a survey that we'd love for you guys to complete. This kind of shows us how we're doing. Are we meeting the needs? Are there things that we're missing? If y'all have suggestions or ideas or any, if you want to volunteer to help us out, we'd love to have your contact information. There's Spanish on the right, English on the left. And that Microsoft form will come back to us, and we'll be sure to follow up with you all as soon as we can. I'll give y'all just a minute to kind of go over that. All right, and we did want to add a little bit of time in. I know everybody's got families to get back to tonight, but we wanted to hear from you guys if y'all had any constructive criticisms or questions about anything that's happening, specifically about the MOA or the actual money pot or any of the programming that we're doing. We're definitely happy to answer any questions. If y'all have any feedback, or if you'd love to just come up and address the group as well. If you have anything to say to the good of the group, that'd be fine.
Yeah.
Yeah.
I can probably be loud enough.
Okay.
I heard you talking about how the money were distributed from your development and the amount that Edgecombe got. Do you think sometimes in this area, because it may be a way smaller community, that they may feel you don't need a whole lot? Like a big city with like maybe Raleigh or, I don't travel to Durham, yeah. So do sometimes you feel like maybe the smaller cities and towns?
Get let down.
Yeah.
Yeah, I think one of the things that we have heard from the state about how the funding was initially allocated was that it was based upon your initial like overdose death rates, but then also by your population that lived there. And I guess that was a good way to start out. But unfortunately, as y'all saw, our numbers have changed a lot. So if our numbers were this bad a couple of years ago, we probably would have gotten more funding. So that is, I think, one of the challenges that we have here for sure. So I don't think it was just because we're small, but I think our numbers weren't as bad and our population wasn't as large. But now things have changed a little bit. We're a growing population now, and our numbers are getting worse. So definitely is a stretch on our already thin resources.
And I just like to make a comment. I've seen the work you do, Dominic. Thank you so much for what you do. You're fantastic.
I have a question, Dalton. How did you go about pitching to the health department the syringe services or exchange program? In Nash County, we're not there yet. It's still negotiating those. We did have somebody who used to do it independently out of their trunk of their car for years and was successful with that. But I'm concerned as a neighboring county what Nash will do. Because I don't know. I don't think our county commissioners are well versed in what substance use disorders or opioid use disorders and what that entails. And how can we as community people and partners, because we're neighboring partners, help them understand? Because we're wasting a lot of time. In the meantime, from data that I collect, HIV, syphilis is on the rise, and we're not doing anything.
Yeah, that's an excellent question, and I wish I could wave my magical wand and fix that. But unfortunately, the syringe service program is probably the most controversial program in the Exhibit A strategies, and that's no secret. Even in Edgecombe, we have had some discussions about that. We've had to do a lot of education about we're not just showing up with needles and giving those needles away and encouraging drug use. I think that's a misconception from a lot of people.
Yeah.
So I think some education kind of starting around that is helpful. I really wish that the state had called that specific strategy harm reduction programs rather than syringe services, because the actual needles that we give out is a very small portion of those kids.
Right.
And it's a very, very minor piece of that strategy. The more important part of that strategy is meeting people, number one, and having a positive interaction, number two, but then also doing the bloodborne pathogen, educating them on how to stay safe, but then also trying to do due diligence with our, public health strategy with decreasing the amount of Hep C and HIV. In the end, these programs have been around for a while. Some of the statistics that we look at is that someone who's engaged with an SSP is 5 times more likely to get into treatment than someone who is not.
Yes.
And 3 times more likely to stop using drugs
Yes.
than someone who is not engaged with an SSP.
Yes.
So these programs work. They protect not only the patients, but also the public. And then when that person is ready to get into treatment, there's this trusted person in their life,
Right.
just like the case from the call last week.
Right.
So, of our cohort of 28 people, already 4 of them have got into treatment and they're off drugs.
That's
So
remarkable.
it's awesome statistics, I think, already. But don't give up. Those can be some of the most impactful strategies. So just because the timing isn't right now, don't give up. Try to educate. And, if there's anything, we're happy to share out, how we do this on the daily or come and talk. We don't mind to do that at all.
All of our neighboring counties are doing, and so it's just, it's a little frustrating.
Yeah.
Because our numbers are showing HIV and syphilis and syphilis too, and Hep C are just skyrocketing.
Yeah.
And I know that will take a dent. It will take a dent.
There's another statistic out there that says someone who's using IV drugs will infect 20 other people with Hep C or HIV or syphilis. And if we can prevent one of those, we've done a good job.
Yeah.
That's a great question, though.
So one of the, on that kind of note, one of the counties that we cover, they started their syringe exchange in a church. Hard to argue with the faith community.
Yeah.
Okay, and then the health department said, you've been doing this for 2 years, we're seeing the first week that you opened up, you had 750 dirty needles come in and 800 clean needles go out. Maybe we need to take this. So when you start, it doesn't always have to start in the health department.
Right.
It's best in probably the health department, but if we can get it in any way you can. EMS, health departments, or churches, or any other agency.
Is mobile syringe services common? How common is that compared to just syringe services?
Yeah, I would say it's not that common. Not as common as it should be. I would almost rather have a mobile site than a brick and mortar site. I think it's more effective. It's less humiliating, and I think you can get to more people that really need it. So I think mobile is the way to go. And not to mention, you don't have to put that on a billboard somewhere. After you start getting some word of mouth going and getting out there and doing the good work, people will let people know who they can trust and who they can't. And that was something that we didn't know how well that would go when a vehicle with lights and sirens and somebody that looks like a police officer jumps out and he's trying to do harm reduction. At first it was difficult, but it's different now.
Word of mouth gets out there.
Yeah.
It does.
But I think those mobile units for the smaller rural communities, like, a lot of drug use in those smaller rural communities. And I think the mobile units going out to them, like you said, it may take a little while. I think they can become more comfortable coming into a brick and mortar building.
Yeah.
Where they can be seen by everybody. Because believe it or not, people in active use care about how they look to some people sometimes. I guess it's pride or stigma has a lot to do with it, but they rather keep their stuff sort of undercover as best as possible without the whole world knowing what's happening.
And the rural communities, everybody knows everybody. So
And then they don't have transportation a lot of time out of those rural communities. So I really like the mobile unit. And
I have a question. How do you get started with the church? If my church, I'm a pastor in Tarboro, and it's the Edgecombe side.
Mhm.
So if I wanted have a program started at Military Times about them.
Definitely. We'd love to, come out and like, first off, just meet you guys. And, we've actually got a Narcan training planned on Saturday with another church in Tarboro. And we got these 1 boxes that we're gonna give out and just talk to them about substance use and things like that. So if that's something y'all are interested in, please email me. I've got my contact information that I can share. And we'd love to, love to get as many people involved as we can.
Yeah, we in Tarboro.
Cool. So I'm going to Eastern Star, I think Saturday. I think it's
The
Eastern Star.
31st. Yeah,
Um, Yes, Miss Dickens.
Dickens,
Yep.
right.
Yep.
That's the one we was going to.
So, yeah.
Cool.
We'll go, I'll be there.
Yeah, but we're happy to
But you'll be
do
coming to-
more.
To our church.
We want to do as many as we can.
Yep.
Cool.
And there are actually a good number of like faith-based specific support programs as well to, to utilize the skill set and connections that exist within those communities. So I can introduce some of those as well.
Okay, thank you.
And I want to connect with this too,
Yes.
because we have a lot of clients coming in and out. And I had to get, for Ms. Meeks, I had to get the boxes.
Mhm.
Narcan, we could probably distribute that many people to come down.
For sure. Yeah, happy to partner with y'all too.
Yes, we need you.
Cool.
Make sure I get your card.
Yes, ma'am.
I will say that North Carolina is going to make a little bit of a change, because I work in outpatient, to where we can start doing a little bit more accommodations to get patients who can't come in daily. Okay, so who can we get to come in and get your medications until you can get it daily? So that is a little bit of a, they're trying,
Cool.
we still need a little bit more of a foot in the door, but there are doing some changes to that. Whether or not we're getting the IPRS, we're getting the IPRS grant, which is a supplement, if patients can't come in and pay, they have, the substance abuse. So we are getting those things. Does it cover everything? No, but we are kind of making some way.
It's good to know.
That's great. No, do you see any additional funding coming from the feds? I know that there was just a new one that came out, 2-3 months ago. But it was like 300 million spread across, but.
Yeah, we're still waiting to hear back on the final Purdue Pharma numbers.
Okay.
We think that'll be fairly substantial.
Yeah.
And then also the McKinsey Fund, that was pretty small. We got about $20,000 from that. It is not governed by the NCMOA, but it has to be used kind of under the option B type stuff. It's best practice. We actually purchased a trailer, to set up as a mobile unit. We're in the process of getting that set up. But we want that to be a spot to where we can have some encounters with people, that we didn't get a referral from. Go set up at the trailer park or at Walmart or at the ABC store, catch some foot traffic, do some blood pressure checks, and just ask them the hard questions while we're there. It'll be a private space, so we're not doing blood draws in the parking lot of Food Line and freaking people out, because a lot of times that's where we meet people. This would be more of a private and intimate setting. So we're looking forward to getting that on the road very soon.
The other question, I know the state held on to 15% of the settlement dollars, and I know one of the counties in the first settlement, they got $175,000.
Yeah.
Wow.
Okay, for 18 years, $175,000. I count.
Yes.
Okay. And so with that being said, I recommend it to them, go to the state because they have 15% of that 750 million.
Yeah.
And ask for more additional ones.
Yeah.
Right.
Just that county. So, I know you have 5 million and that over 18 years, that can be spread thin. But and with all this good stuff that you're doing, I'd go market to the state and say, here's what we're doing different than any other county.
Yeah.
Can you, feed us some of that, because they have their special projects.
Right.
But you can offer them another special project.
Yeah. I like it. Does anybody have anything else? Anything from our media friends?
I just wanted to add, because I know that you mentioned the
the mobile buses and about how it would be like more private. I think that would be a good thing to help to address and make addressing the opioid situation more trauma informed, because there's this wide misconception out here that people get into drug and substance abuse because, oh, they're just careless people that make bad mistakes. But when you listen to the life stories of people that are suffering from substance abuse, these are people that have suffered most of the time from, extreme levels of trauma, and they utilize opioids to cope with it, whether it be medical trauma from not having their needs met in the medical system, whether it be trauma that they've experienced with the people around them, or whether it be systemic trauma that they've experienced on a wider level. So addressing that trauma, I think, would really help to reduce the rates, and would not only reduce the rates of, people that are getting addicted, but also help people to recover from substance use disorder. As a community health worker, I've been working with the community and listening to the stories of the people. And my belief is that nobody should, substance use disorder should not be a death sentence for somebody, and nobody deserves to die because of a substance use disorder. And and our system shouldn't be created or maintaining maintaining a society where people are dying from substance use. So I thank you for creating this forum. It's crucial for our community to get together and talk about these difficult things.
Sure. Yeah, and I think it probably has affected more people in here than we care to count, in either both their personal or family life. And if you haven't been touched, you probably will be pretty soon, or you just don't know about it. So yeah, it's just definitely a big problem. We've got some other things planned to do some education with healthcare providers, kind of centered around that trauma-informed, way of asking questions and things, and being curious and not judgmental, because I think that goes a long way. So those are some things in the works, and I think there's more good things to come.
And it is a lot of people getting clean and staying clean too. Don't look at that aspect, but it is. It's just with 20,000 people in DC, and everybody was not clean.
Wow.
Everybody was clean. 20,000 people. It was the World Convention.
I think it was you, I remember saying it this saying, but there are more people living in active recovery than there are.
Exactly.
That is very
But you don't hear those stories.
right.
You just hear about the worst side of addiction, not the good side. I'm coming up on 13 years. I used for 27. I really thought I was gonna die in addiction because I did it for so long. And look at me now. I'm coming up on 13 years. I got 37. And a lot of times people think women don't recover well. That is always the men, but women recover too. Yes. I think women recover and be stronger than a lot of men. And another misconception, which I preach, or I did before I took my sabbatical, I had to tell my groups at Coastal all the time. Because I work with mental health and substance disorder. I'm a mental health coach. I've got a associate degree in human service substance use. So I learned a lot about trauma in crisis that can lead over into substance use. A lot of people have the misconception that substance use is just there. No mental disorders involved, but the mental disorders are there first before the substance use, the trauma. People need to understand that. I've had a lot of the groups say, well, I don't do drugs, so why do I need to listen to this? I said, because I can learn you something about mental health disorders that you may not know, because in the process of being in addiction, learning about myself and going into recovery, I found out I had mental disorders before I started using. but wasn't aware of it, because I lived with those events and trauma for so long, I didn't know what it was. So education is the key, but it's getting people to accept that education.
Yeah.
That's the hardest job.
And there's a lot of mess out there too.
Yeah.
A lot of misinformation about
It is.
medication assisted treatment
Oh, yeah.
and, what recovery truly looks like and there's a lot, to go on with that for sure.
Just a lack of empathy that I've seen in general. It's definitely crippling towards the progress of, addressing the fact that we have substance use disorders, but also addressing and helping people that do have these disorders, and also to prevent people from having to encounter such a situation.
Yeah.
Well,
it's-
we're the voice now.
Mhm.
We're gonna tell it, we're gonna spread the word. Negativity go a long way, so now we're gonna reverse it and make it positive. Yeah, look at me now, I was this, so looking at her, you would never know. So you can't judge a book by its color. Exactly. So she overcame, she's helping, and a lot of them don't have that support.
Yeah.
You don't know their why. Why did they get on drugs? No, I'm not a user, I just like helping people.
Yeah.
I'm in the medical field as a pastor, and that's my thing. To help people and get people aware. And I have family members that are on drugs. My brother, I haven't seen in 7 years. I don't know if he's alive or dead. So I just pray for him every day. So we have to be the voice for the ones that can't speak. Yes, for the voiceless. Amen.
Yeah.
And thank you for doing that.
Yeah, and I'll leave you with one more story as we kind of close out. There was a guy who I met a couple of, I guess it's been about a year and a half now. He was a 22-year-old black male from Canada, of all places.
Oh, wow.
And he was buying drugs for the sheriff's office because he had been wrapped up into the perk 30s and he was using, and he got busted with some, so now they were using him to buy more to get, the drug dealers in trouble and all this. So he was using upwards of 20 to 25 pills a day. And about, 3/4 of those perk 30s have greater than 2 milligrams of fentanyl in each one. So his opioid tolerance was really, really, really high. And he was really, really, really young. So he was having to wake up in the middle of the night to take one because he was sick to go back to sleep. First thing he'd do in the morning is pop 3 or 4 of them, right? And that I thought substance use was terminal for that guy. And he was ready to get off of drugs. So we plugged him in. He didn't do well on Suboxone because his tolerance was so high. He went to Greenville to a methadone clinic there. And with all of my visits that I did with him, there was a guy in a car there. Never talked to him, never seen him, none of that stuff. Fast forward a couple of months, this patient is doing great. He's been clean. He's been going to his appointments. He has a job, all of the good stuff. And there was a guy who pulled me kind of by the shoulder at a community event in downtown Tarboro. He was there with his family, and he said, I was the guy in the car. And the guy who got into recovery pulled him along with him. It was a ripple effect. So y'all, the things that y'all are doing in the community matters. And the ripple effect, you may not see it one day. I hope you do. But that was just a special thing that I remember the last couple of months. He was standing there with his kids and stuff, and he told me, he said he went to bed one night with $2 in his wallet, and he woke up the next morning with that same $2 in his wallet, and that had never happened before. And he knew right then that things had changed. His kids had Christmas and all that stuff, and that was just really, it was really special. And people can hear those stories. I think they would change their minds sometimes.
Oh, yeah.
So, thank y'all for coming again. We have some gift outs up here. We missed you, Trent. Please get you another plate of food. Hang out for as long as you like, and I will put up some contact information for us as well.
Yeah.
Thank y'all for coming.
I need that card.
Yeah.
Can I get your card too, young lady?
I'm coming to you.